Hello, everyone. Well, today we bring a completely different therapy, which most of the women don't even know about it. PRP. Well, to talk about this, we have MD, Dr. Bryan with me. He has been doing this research and working with other researchers for the last 20 plus years, helping perimenopausal women with PRP therapy. So we're going to find out how this therapy can be beneficial for women going through perimenopause. Thank you so much for joining me.
Thank you for having me.
I'm going to let you talk about this.
Okay, well, first of all, we got to tell everybody what PRP stands for. And PRP is platelet-rich plasma. And for the hair loss thing, you're kind of focused on hair loss. And most of my career, I've taken care of women that are perimenopausal in their 40s. And one of their issues as their hormones become imbalanced is loss of hair. And there's a variety of reasons for that. Sometimes there's dermatologic problems. There are hormonal issues. And the interesting thing about losing hair, and this is true for men as well, is there's like a sweet spot for hormone levels. And I've just found that over the 30 years I've been doing this, there's always a sweet spot. And my job is to figure out for that person, that woman, what is their sweet spot? And when I find the sweet spot, everything kind of falls into place. So when hair is being lost, it can be from too much hormone, or it can be from too little hormone. So sometimes you have to bump the hormones up. Sometimes you got to block the hormones. And for women, a lot, we're talking mainly about androgens or male hormones, testosterone, DHEA, which stands for dehydroepiandrosterone, that comes from the adrenal gland. Women make testosterone in their ovaries and their adrenal gland, and they can be low. They can have low testosterone just like men. They just don't have erectile dysfunction, but they get all the other same fatigue and loss of energy, and they gain weight in their midsection, and sometimes their hair falls out. And usually it's right up here. And you've seen women, I'm sure, as they age, where their hair is so thin that you can see their scalp. Okay, I'm lucky. I'm 62 years old, and I have a full head of hair. I've lost a little bit here, but not much. And so I've been kind of known for my hair, and I keep it long. So women kind of want to not lose their hair. It's a thing. So this works, platelet-rich plasma, virtually, I mean, nothing works 100% of the time, but this is pretty close. You mentioned chemotherapy hair loss. That's a whole different issue, and that hair usually will come back. So you wouldn't use this for this. This would be for thinning hair in perimenopausal and menopausal women, using a woman's own platelets. So you're not doing anything weird. You're not putting drugs into people's scalps. You're not doing bizarre things and things with side effects. I mean, you can't have side effects to your own blood and your own platelets. So what we do is we talk about it. It's fairly simple. You have to do it several times sometimes because hair follicles grow at different rates. So they can be in senescent stage where they're not growing, and then you want to use the platelet-rich plasma and stimulate the hair follicles that are actually in growth phase, and they're only in growth phase certain amounts of time. So we draw blood, just like you're having a blood test. You spin that out in a certain tube. You have to have a yellow top tube, and then you have to have a certain centrifuge that will separate serum from whole blood, and right in the middle is the buffy coat, it's called, which has platelet-rich plasma in it. And you can take that tube and pop the stopper off, and you can draw up the platelet-rich plasma into a syringe. So if you're doing a hair restoration procedure, you can put some numbing cream on the scalp because you're using a little needle. You're going to inject the platelet-rich plasma just underneath the scalp skin, and you kind of do a grid. So like you're planting corn or something, if you do a grid and you inject that platelet-rich plasma, and then you take a microneedling device, which has been used on the face. You can do this on the face as well. Platelet-rich plasma. It's called it's called a vampire facelift is what it's called. So you inject the face and you take a microneedling device. There's several, 3 or 4 of them that work pretty well. And it feels sort of like a cat is licking you. And so you're basically taking this little teeny microneedle device and turning it on, and it's tattooing the platelet-rich plasma into the scalp. You can also take some of the platelet poor plasma, the serum above the buffy coat, and smear that on the skin, and you run that microneedling device all over the scalp. Here's the beauty of that. Platelets do several things. You think of platelets as being a blood clotting fragment of a cell, and it's involved in blood clotting, but it also heals tissue. So if you ever had a scab, like here, wherever you get an elbow scab, and everybody picks on it, right? They pick, and eventually they'll pick that scab off, and you see that kind of gooey, kind of yellow stuff. That's platelet-rich plasma. So platelet-rich plasma heals trauma. So what you're doing is telling the skin under the scalp there's trauma, and you're traumatizing the skin with these little 33 gauge needles that are kind of needling little traumatic holes in the scalp, and the platelet reads, and then you've injected, the platelet reads that trauma and it rushes in to fix it, to heal it. And if you have follicles that are in a growth phase, and the hair follicles in a growth phase, it will respond to that platelet-rich plasma and turn on a rapid growth phase. So you will have follicles, even in bare scalps, there's follicles under there. Some of them are quiet, and some of them are waiting to be turned back on. Okay, so the platelets turn those follicles back on. That's a very simplified way of explaining how you do a hair restoration procedure for women. So my most successful person that I ever did this on was a woman in St. Louis who was African American, and she was 36 years old, and she had hair around here, but she was basically bald. So like right here. And so the way she wore her hair, she had dreadlocks, and she would wrap them across the top of her head so you couldn't see it. And so when we saw her, I said, well, this is going to be a challenge. I said, we'll do it, and we'll just see what happens. And I also put her on Rogaine as well. So she was using Rogaine after the platelet-rich plasma and microneedling procedure. So I did the first one, and I had her come back every 4 weeks, and we did that for 6 months. And lo and behold, she grew her hair back. So within about 3 months, she had a stubble, and we just kept putting the Rogaine on it, and she just kept growing her hair back. Now, she didn't have like flowing locks of hair at 6 months, but she was growing hair. And that's typically what you see with women. So most women are not completely bald up here. They've got thinning in the front and the sides, and you focus on that, and you put some platelet-rich plasma and microneedle around the kind of the crown of the head, and they almost 100% of them will grow hair. And this, I'm talking about women in their 60s and 70s, they'll grow hair. So it's a fascinating little procedure using what's basically a stem cell. So it's kind of a stem cell treatment that isn't a drug. It's not now I used the Rogaine on her. Most women with just thinning hair, you just do the platelet-rich plasma procedure a few times, a month apart, and they grow hair. And their hairdressers will say, what are you doing? You've got hair growing. And they go, well, I had this guy that injected my head with my platelets and microneedled them in, and I started growing hair. So it's a very satisfying thing to do, because women do not want to go bald. Trust me, they don't. And most of them get thinning hair in their 40s and 50s. So that's the basic procedure. It doesn't take long. It sounds, like it would hurt, but it doesn't. I mean, like I said, it feels like a cat's tongue, only a little stronger than that. And if somebody has a low pain tolerance, you just pre-treat them with some xylocaine cream or gel or ointment, and let that sit there for about 30 minutes, wipe it off, and you go to town, and they're fine. Works on men, that as well. It's about 50% in men. You'll get about 50% of them that will respond, but I'm going to say 85, 90% of women will respond. That's the basic gist. Yeah, it's pretty fun. It's cool.
Fascinating, fascinating. Interestingly, I have to share something with you. In Ayurveda, I've been interviewing so many of experts such as yourself from all over the world, for the last couple of years. But Ayurveda has a very, how should I say it, a very basic thing that they use, not the platelet-rich plasma, but they use something called the leech therapy. So what they do is they put leech on your head, and the leech will kind of, I think, take blood out. And I don't know what they, do you want to compare? Is that comparable? I don't know. I mean, they swear to it that you will grow hair. I have, that's what I wanted to ask you. If you have heard about leech therapy.
I teach physiology and anatomy, and one of the things we talk about is leeches, which, were kind of banned and antiquated back in the 1800s. They used to use leeches all the time. So many leeches that in France that they ran out of leeches. They were using 45 million leeches a year in France. So in 2014, I think, the FDA, after some published results, usually for microsurgery on hands and ears, they approved leech therapy. It's an FDA approved therapy. My university hospital over here at the University of Missouri has been using leeches for several years, usually for the ears, reattaching ears, fingers, and hand surgery. They'll put a leech on there because leech saliva has an anesthetic and an antibacterial in it. I don't know if it has growth factors in it. So I'm not going to say it would work for hair, but I'm guessing that you've read that somebody's done it and it works. There's another company in Los Angeles called AQ Skin Solutions that has growth factors for hair that does not involve drawing blood or platelets or microneedling. You just use this serum, growth serum, and that works pretty well. I've done that as well. So people that, they think, ooh, that's needles, I don't want to do it. I don't want my blood drawn. I hate that. So you can use AQ Skin Solution treatments, and that takes, you start seeing results at about 6 weeks. And I'm going to say that the treatment, it's once you do it every day, and you change the serum thing. So you get like 6 bottles of serum, and you do it every day. And I want to say that costs about $300 every 6 weeks. So a platelet-rich plasma procedure, we were charging $650, I think, for that. And that was a series, depending on how often you would do it. So the lady that did 6 months in a row, she spent some money. And I think we gave her a package deal or something like that. So it's, anything that involves, you got to buy a $10,000 centrifuge, and you have to have the kit for the platelet-rich plasma, which is like $125 a piece. And then you just have to have the equipment and all that. So it's about, I'm going to say, it depends on where you do it and who's doing it. It's not a surgical procedure necessary. You want to, I mean, you can't do it sterile. You got hair, right? You're doing that with people's hair, so you can't really sterilize. The equipment you can do it, but the head you can't sterilize, really. So nobody's putting betadine on it or anything, or Hibiclens or anything like that. So it's It's a fairly non-invasive, well, it's non-painful, I guess. It's a little sticky, but it's not terrible. Nobody ever said, oh, that's the worst thing I've ever done. I'm never doing that again. So it's, you know, it's just one more thing in the armamentarium of taking care of these aggravating symptoms that perimenopausal and menopausal women get. I mean, it's quality of life. Who wants to be bald if you're a female?
No,
You know?
no. That's what
Yes,
we
some
are
do.
discussing. Options for women out there who have so many symptoms, and some of them they don't know where to turn to. So like you said, hormones can be elevated or it can be going down. You don't know what causes, and then there your hair is thinning, your vagina is going out of shape. I mean, there's so many things, but today's focus was just on the platelet, the PRP for hair. But there's so many other things that are going on with perimenopausal women. Yeah, but this is a quick 10-minute session that we bring. It's a very short session. I would love to have you come back and we talk about something else, because there's so many other things, since you've helped so many perimenopausal women in the last 20 plus years or so.
Yeah, we can do that. I mean, I can talk about this stuff for hours. So platelet-rich plasma, I managed to condense that into 10, 15 minutes. But yeah, you start talking about hormones and I can go on and on and on and on. So yeah, have me back, do that.
Yeah, absolutely. I'll have you back. We just try to keep it 10 minutes because a normal consumer can only take this information in bite size. So we keep it short so people understand. That's the only reason. Thank you so much for joining me today. Thank you everyone else for supporting us. We are supporting perimenopausal women through their journey with holistic therapies. So stay tuned. We are launching our programs. Super excited, and stay tuned. Thank you. Thank you so much.
See you. You're welcome. Thank you.